Good morning, everyone. 8:23 on your Friday morning. Well, celiac disease affects 1% of the population, yet so many people don't even know they have it. What they do know is that they're uncomfortable and they don't feel well. So here to help us better understand this disease is gut health expert Justine Dowd from the University of Calgary. Good morning to you, Justine.
Good morning, Leah.
So why don't we start right there? So how common is celiac disease?
Sure. So approximately 1% of the population is affected with celiac disease. So that translates to approximately 100,000 Canadians. And what's interesting, though, is that 80 to 90% of the population of celiacs are undiagnosed.
Undiagnosed.
Right. So over 300,000 Canadians remain undiagnosed and are suffering needlessly.
They really are, absolutely. So why don't we first understand what exactly is celiac disease?
So celiac is a chronic autoimmune condition where your body cannot digest gluten. So when you eat it, it actually causes an autoimmune response, and then it starts to break down the villi in the intestines. And so this can lead to really long-term negative complications, so malnourishment, osteoporosis, different types of gastrointestinal cancers, migraines and skin conditions, and a whole host of different problems.
Wow. And so then what does that mean in terms of symptoms that a patient's going to be feeling if they are in fact having this and are undiagnosed?
Well, often it presents with gastrointestinal things, so bloating, diarrhea, constipation, pain, that sort of thing.
Right.
But interestingly, it's also associated with migraines, skin conditions, other things that aren't associated with your gut. And I know before I was diagnosed, it was so interesting. Some days I was so confused because I could eat gluten. I could have a sandwich or a bagel and feel fine. And then other days I could have a tiny cracker and be in bed for a day.
Wow.
So it's very interesting. And just because you can eat gluten and feel okay sometimes doesn't mean that you're off the hook.
Right, absolutely, right? So the question then, I guess, is what to do about it, right?
Right. Well, it's so important that you speak to your doctor before you go gluten-free.
Before you go gluten-free. Okay,
Right.
why is that?
Because if you go off of gluten before you get the test done, then the tests are no longer valid, or they can't test because you need to be eating gluten for a long time, at least a couple of weeks, to have the test actually do their job and see if you are celiac or not.
To see if you are celiac. Okay, so what do the tests look like?
So it's a blood test, so you simply just go to the doctor and ask your doctor to check and tell them what you're experiencing, and it's a free blood test.
Okay, just like that. So, but there's so many misconceptions when it comes to celiac disease, and it's often confused for all these other gut health issues. Can you sort of shed some light on that for us?
Right. So it's tough because celiac can look like many other things as well. We know irritable bowel syndrome, IBS, is very common these days as well. 1 in 5 people, if not more, are affected by that as well. And so it can be complicated, and that's why it's so important to speak with the dietitian or your doctor. And if you don't feel supported by those people, keep looking out or keep reaching out for that team, because there are so many wonderful people who are so keen to help, and you will get those answers.
And you will get those answers. And then once you get the answers, then you can look at treatment options. So what does that look like as well for people?
So people with celiac, they need to follow a strict gluten-free diet. And so that is the #1 line of treatment, but my research at the university is looking at other ways to help, so things like self-compassion, so some of these emotional coping strategies, as well as exercise and how that can help, maybe not necessarily as a treatment, but just for long-term coping, so that you don't just feel okay, you can feel great.
Feel great. Wonderful. Now you have a gut health series. Tell us a little bit about this.
Yes.
It's ongoing.
So I'm so excited to be offering this to the public now. I'm so passionate about being able to help people understand their gut health issues, and so we're offering this series at Velo Cafe, and it's a 4-part series. We have 3 more that are coming up Mondays and Tuesdays this month.
Perfect.
And there's more information on my website, and we have a variety of different gut health experts just talking about different topics that are related or that are relevant to people struggling with gut health.
So everybody can just feel a little bit better.
That's the plan.
Justine, thank you so much for being here and telling us all about it.
Thanks for having me, Leah.